Hey everybody, my name is Bailey Manier, and today I'm going to be talking to you about a fractured hand or wrist and what it would look like for somebody who has this injury to go through physical therapy for it. First off, I'm going to go over the basic anatomy of the hand, and this is so that you can have an understanding of how the hand works. Hands are capable of a wide variety of functions, including gross and fine motor movements. Gross motor movements allow us to pick up larger objects or perform heavy labor, such as, moving furniture around, different kind of things like that. Fine motor movements enable us to perform delicate tasks, such as holding small objects or performing detailed work, such as, art, writing with pencil or pen, things of that nature. Okay. So, what are the different parts of the hand? Well, simply put, the hand can be broken down into 4 different segments. These being the fingers, the palm, the back of the hand, and the wrist. The fingers are the digits that extend from the palm of the hand and allow us to grab smaller objects. The palm is the bottom of the body of the hand, or the base of the hand. It gives the hand its structure. The back of the hand allows for veins to run through our hand into the tips of our fingers, allowing for the tendons and bones and muscles to get blood from the rest of our body. The wrist is a connection point between the arm and the hand and allows for most of our hand movements, extension, flexion, and such. Each hand consists of 19 bones. The palm includes 5 metacarpals, and each finger, except for the thumb, contains 1 proximal phalanx, 1 middle phalanx, and 1 distal phalanx. The thumb doesn't have a middle phalanx. Each bone is connected by a series of ligaments. So now that you have some sort of understanding of the anatomy of the hand, I'm going to go over some of the most common reasons for this injury and some of the symptoms you might feel along with this injury. The most common for this injury is in the wrist, when people try to catch themselves during a fall or land hard on an outstretched hand or overextended wrist. A broken wrist or broken hand might cause these signs and symptoms. Severe pain that might worsen when gripping or squeezing or moving your hand and wrist. Swelling, tenderness, bruising, obvious deformity, any bulge or anything that you might see, crooked finger, bent wrist, stiffness or inability to move your fingers or thumb, and numbness in your hand or fingers. So these are just some of the symptoms that you can have from the results of this injury. Some other complications that you might encounter with a broken wrist or a broken hand are rare, but they might include the following. Ongoing stiffness, aching or disability. Stiffness, pain or aching in the affected area generally goes away eventually after your cast is removed or you've gone through surgery. However, some people still experience permanent stiffness or pain. You need to be patient with your recovery and talk to your doctor or physical therapist about any exercises that you could do to help loosen up the tendons and strengthen the muscles in the surrounding area. Osteoarthritis is also another rare symptom that can come from a broken hand or wrist. This can come from fractures that extend into the joint. It can cause arthritis in later years. And the last one would be nerve or blood vessel damage. Trauma to the wrist or hand can injure adjacent nerves and blood vessels, which can later on cause a lot of issues with blood circulation and even narcosis in your extremities, phalanges, which can lead to you actually losing some of your fingers if you don't get it treated. So if you ever were to experience any numbness or circulation problems in your wrist after your injury has healed, it would be best that you seek immediate medical attention to get it resolved. So now let's go take a look at my patient that came to me with a fractured wrist. Jose is a 23-year-old male who came to me with a chief complaint of feeling a widespread pain in his right hand and having difficulty moving his wrist. Jose started noticing the pain the night after he had caught himself from falling at work earlier that day. His right hand is also extremely swollen. I took his medical history and I also assessed him. I found that he weighed 195 pounds and he is 6 foot 3 inches. At first sight, my thoughts were that he had a possible fracture in his right hand, or even a possible tear or strain of an extensor muscle or flexor muscle in his right wrist. After assessing him with his widespread pain along the wrist, he had extreme swelling in the metacarpal area and surrounding area. He also had trouble with flexion and extension and adduction and abduction of the wrist and hand. And what I found was that he has completely fractured 2 of the metacarpal bones within the right hand with slight displacement of the fractured bones. This was of course confirmed by an x-ray that was given earlier by his doctor. And now to continue on with the plan that I would put him through after getting the cast removed. Now, to give a little background information, Jose would have already gone to the doctor. He would have gotten his x-ray done. He had his cast put on, and he may have even gone on a surgical procedure in order for his bones to be put back into place, to fix the displaced bones in the wrist. Now he's at me after he's gotten out of his cast per doctor's orders. The cast is possibly the most important part of the healing process because it is extremely important to immobilize the bone, to give it time to rebuild itself, strengthen itself, to prevent further injury or re-injury in the future. Jose will be sent to me where he will follow my therapy plan that I've created for him that focuses on strengthening the muscles and tendons of the wrist in order to prevent injury in the future as well. It is important to move your fingers regularly while the fracture is healing to keep them from stiffening. You don't want any muscle atrophy or anything like that while your hand is in the cast, because that will make your recovery harder and it will also take longer. During your recovery, you may also want to take anti-inflammatory or over-the-counter pain reliever to help with some of the pain. And here I'm going to show a couple of videos that are going to show the different stretches that I would give Jose in recovering from his fractured wrist. So the first video I'm going to show is actually going to focus on more of the fingers rather than the wrist. This is because the fingers are a major part of the hand. Mute that real quick, and I will go ahead and skip to the first exercise that he does, which is roughly around right here. So what he's going to do is he's going to fully extend the fingers of the hand, and he's going to bring down just to that middle knuckle. He's going to bring them down to the edge of his palm. And what you're going to want to do is you're going to want to do this 10 to 15 times. And then after you finish those, you're going to make a sort of a table with your hand like he's doing in the video. And you're going to flex the fingers back and forth just like he's doing there. Not coming up more than 90 degrees or making a 90-degree angle with your fingers in your palm. Now the next exercise that he's doing a full extension from fist to full extension over and over again. And all of these you're going to want to do 10 to 15 times. And what you're going to notice is that even though these movements are actually rather small, your hand's going to get extremely tired, especially after being in a cast for so long. Here he is doing adduction and abduction of the thumb, moving it back and forth over and over. And what he's going to move into is actually just rotating the thumb around the front of the palm and doing the same movement. It's working a different muscle. And this is actually the last exercise for the fingers that you're going to do. Is you're going to bring the thumb to each finger, the tip of each finger. So pinky, ring, middle, index. Pinky, ring, middle, index. And you're going to do that over and over again for 10 to 15 times. Alright, and now I'm going to show you the next video, which is this is actually the wrist part of the same type of exercise. And what he's going to do here is you're going to lean on a table or your bed. Your bed would actually probably be the best place to do this. Or you can do what he's doing here, which is he lays a pillow down on a table and he leans on that. What you're going to do here is you're going to internally rotate your wrists over and over again. Again, 10 to 15 times. You don't want to do, you can do it more, you can do it less. It just depends on how sore your wrist is afterwards, or your hands are after doing all of these exercises. And now, moving into the next exercise, with a closed fist, not really a fist, but a closed hand, you're going to move the hands up and down, up and down. And this is going to work your abductors and your adductors muscles of your wrists. And now here he is doing the pronation and supination exercises, which help with flexibility and rotation of the wrist. Next, you're going to clasp your hands together and you're going to work the flexion and extension muscles. This is going to work those muscles, and it's going to also loosen them up while strengthening them as well. Alright, and you're going to do almost the exact same exercise you did before. You're going to do abduction and adduction for roughly 10 to 15. And then the last and final exercise is pronation and supination, which is just... And this is going to end my video. With those exercises, if you're going to want to follow the 1 hour rule, and what that is that after 1 hour of completing those exercises, if you are feeling extremely sore, it might be best if you actually cut back on the number of exercises you're doing. Instead of doing 10 to 15, you could do 8 to 10, or if that's even still too much, you can do, 5 to 6 of each one. Also, it goes the other way too. If you're not feeling sore at all, maybe kick it up a notch, do a little more. Maybe 16 to 20 reps instead of the 10 to 15. But thank you all for tuning in on my video, and I will see you next time.